Hi, I'm Dr. Wesley Shankland, and welcome back to our YouTube series on temporomandibular disorders. Today I want to talk to you about how do we treat a displaced articular disc. Now I want you to remember the articular disc is interposed between the temporal bone and the mandible, the temporomandibular joint. And the disc is placed just like this lightly, very nicely, but it's held in place by ligaments, just like your knee. You hear about the cruciating ligaments in the knee being displaced because someone is blocked sideways and tears the ligament, especially the medial collateral ligament. Or a problem in the TM joint is the medial collateral ligament there too. It's very small and it tears easily. So blows to the jaw, motor vehicle accidents, falling down, getting hit with balls like basketballs or volleyballs or soccer balls can displace this disc easily. So I want to talk to you about how we reduce this discal dislocation. As I was mentioning earlier on the skull, the lower jaw, the upper jaw, the mandible, the temporal bone, interposed between these two bones, comprising the temporomandibular joint, is the articular disc right here. And it's held in place by some tissue here called retrodiscal tissue, and that's made up of elastin tissue for blood vessels and nerves. Also, the disc is held in place by a ligament on the lateral side and the medial side, the inside, the medial collateral ligament. And it's also positioned right here by a muscle called the superior pterygoid muscle. Now, if someone is hit in the jaw like this lower jaw, this condyle is driven upwards in the TM joint, and what ends up is the disc is displaced, the ligaments are stretched or torn, pressure is applied to this retrodiscal tissue, and this superior pterygoid muscle goes into spasm, produces ear pain, temporal pain, facial pain, even pain down the neck and shoulders. So, what do we do here? Well, some way we have to reposition this lower jaw to end up looking like this, like a normal joint. Condyle, disc, temporal bone. We have to some way put this back into place, but what can we do? Sometimes people walk into my office with their disc like this, and they have a history of joint clicking, but now they can't even open their mouth more than a half an inch to an inch. They can't chew, they can't talk, they can't brush their teeth, and worse than that, if they get in a motor vehicle accident or some kind of emergency, they have to be intubated at the hospital. You can't intubate somebody. Sometimes they have to go right through the throat right here. So we have to unlock this joint in order for this joint to work properly and let that disc work well. How do we put this disc back into place? Well, fortunately, some people come in the office and their joint is already clicking or popping, but it does go back into place. I can easily grab their mandible like this, and grab is a bad word. I really manipulate the mandible and it'll go back into place. But most of the time, we have to give an anesthetic. But before that, we give a sedation. We sedate the patient so they are so lightly sedated. They used to call this twilight sleep years ago when women gave birth. They gave twilight sleep. We do the same thing. We give them an oral medication. They're sleepy. They can still respond. They can still breathe on their own. We monitor their vital signs, but they're so sedated they don't care what I do. So once they take the sedation medication, then we put a little bit of local anesthetic right here in the joint, just like you're going to have a crown or a filling done in your dental office. And by numbing the joint up, now the joint is totally numb. I can manipulate the mandible. They have no discomfort. And then being sedated, their muscles are so relaxed, they don't care. It doesn't hurt. It doesn't hurt at all. So I can manipulate this mandible. And then what happens is, this joint is like this disc is out of place, and I hear a click sound, a sound in the mouth, and the joint goes back into place, and that disc ends up looking like this. The disc is back in place. With the disc back in place, they have normal ranges of motion. They can open wide without any change in the opening and closing. They can move laterally, and most importantly, they get out of pain quickly, their joint doesn't click, and they no longer have dysfunction. But what do we do after that? We just can't leave them like that, because they'll lock again, and sometimes they will. Thank you for watching this video. If you have any questions or comments, put them down below. I read all your questions, all the comments. I try to answer all the questions, suggest topics for videos in the future, and I'll try to address them. Thank you for watching.